So I went to Washington, D.C. to serve as a medical officer and senior program manager for comparative effectiveness research, which was a $1 billion program in the Obama administration, funded initially by the Recovery Act, which has now morphed into the Patient-Centered Outcomes Research Institute that is funded by the Affordable Care Act. I went to D.C. because it was a very unique time. It was in the throes of health reform, and there was a great opportunity there to change the way we think about not only delivering healthcare, but also financing healthcare in a way that is sustainable for the future. And I was motivated to go and be a part of this first, just kind of in a very broad sense. But then secondly, I definitely bought into the idea of comparative effectiveness research, which was, how do we think about generating evidence that compares different treatments or different methods of diagnostics, for example, to one another, to generate the best evidence to make decisions for patients or to guide patients through their own decision making. It presents a great opportunity for us to not only advance the science of medicine by itself, but also to think, well, amongst the science that we already have, how do we get the most value for patients? And I think that has been a big shift in how we think about healthcare in the United States now. It's no longer simply about let's have the best science and the best technology. That is a very core part of what we will still do and will continue to do for the future. But now it's also, with the technology, the investments that we currently have, how do we get the best outcomes? How do we deliver the best care? I think that is one of the biggest contributions when we think about the health reform activities that took place a couple of years ago. And being a part of that was very inspiring and why I went to DC. So Affordable Care Act offers a lot of opportunity. I think, for example, to give a couple of examples, the CMMI, or the Centers for Medicaid and Medicare, now have an Innovation Institute for all practical purposes. They're funding a lot of work which allows all kinds of different institutions. So this can be academic medical centers, it can be more community-based centers, it can be nonprofits that are working across different stakeholders to think about how do we innovate in healthcare again? So how do we improve patient outcomes? How do we improve the way we pay for healthcare? The government, or the Affordable Care Act, has a couple of very important levers. So one that we've heard a lot about currently in the press is payment. So how we pay for healthcare influences how all of the different components of the healthcare system then subsequently behave. So hospitals and physicians are often picked out as one of the key levers or the key responders to these levers like payment. The federal government has done a nice job with the Affordable Care Act of laying a framework, of laying a foundation of policy type innovations to then stimulate, encourage, and fund providers, payers, hospitals, physicians, all the different components of the healthcare system to work together to and kind of coordinate around how we improve the processes of healthcare delivery.